Live from the Bob Levy Broadcast Center, overlooking the Toms River, it's time to get up, get out, do something. Wake up with Jeremy Grunin. Be a part of the show, 732-505-1160. News Talk Radio WOBM AM 1160 and 1310. Listen online at WOBMAM.com.
Welcome back. Wake up with Jeremy Grunin. No welcome back to the red light, though. Welcome back. Wake up with Jeremy Grunin. It is 7:09. It is March 2nd. Going to be around 52 degrees today here at WOBM AM 1160 and 1310 from the Town Square Media Towers. News Talk Radio. Streaming at WOBMAM.com and on the Radio Pup app, 732-505-1160 if you want to talk. Right now, we're talking to Dr. Stanley Michael. He is an orthopedic surgeon and medical director of the Joint Replacement Program at Southern Ocean Medical Center. Good morning, Dr. Michael.
Good morning, Mr. Grunin.
How are you?
I'm very well, thank you. How are you?
I am fantastic. Thank you so much for joining us this morning.
Pleasure.
All right, so I have all kinds of questions because listen, I don't know nearly as much as I should about medicine, about hospitals. Yes, I'm on the board of a local hospital. Yes, I'm married to a nurse. Yes, people in both my wife and people at the hospital laugh at me for my lack of knowledge around medicine. So I'm hoping, Dr. Michael, that you could help me today as it pertains to orthopedics.
Do my best.
So tell us a little bit about this specialty. What's the scope of care and services that you specialize in?
So the field of orthopedic surgery basically involves treating bone and joint conditions. And even though people think of an orthopedic surgeon as a surgeon, in fact, the vast majority of patients we treat non-surgically. For instance, for every operation that we do in this field, we probably treat about 15 or 20 patients without surgery. And a big part of that treatment also involves the soft tissues. It's not just bones and joints, but it's ligaments, muscles, tendons. So it's a very large field. We treat everything from the spine to the foot and ankle and the shoulder and hip and knee. Basically we treat conditions involving the bones, joints, muscles, tendons, ligaments.
Wow, that's great. I probably should get to know you better because there's pretty much not a time that I wake up that I'm not in pain somewhere, although my pillow has helped me with that. So let me ask you this, because I don't think everybody really truly understands how much schooling did you have to go through to become an orthopedic surgeon?
So I did a bit more than many because I did two residencies. I did a residency in general surgery and then orthopedic surgery. But most people who become an orthopedic surgeon would, after high school, would do 4 years of college and then 4 years of medical school. After that, you become a doctor, but you're only a basic doctor. So then to become an orthopedic surgeon, all programs involve a 5-year residency.
Oh, my God.
So you go through that, and then after that, if you want to further specialize, you might do what's called a fellowship, typically for 1 more year. So we're talking of school 12 years, 4 years of college, 4 years of med school, 5 years of residency, and then perhaps 1 year of fellowship.
Oh, my God. So right when you turn 47, you're a doctor.
If you go straight through, most people are about early 30s when they become orthopedic surgeons.
Now, am I wrong? But should every surgeon be a Bernie Sanders fan? Because I got to imagine that you had to come out with about $7 million worth of debt from all the schooling you had to go to.
That must be quite a lot.
Okay, good. All right, good. All right, so talk to me. What are some of the common causes of joint pain?
So the most common would be various forms of arthritis. The most common being the wear and tear kind called osteoarthritis. But there's many other kinds which involve inflammation like rheumatoid and lupus. And the second large group would be injuries of all kinds, fractures, dislocations, and their consequences. And there are other causes that are unique to each joint. For instance, in the knee, torn cartilage called the meniscus tear is common. In the shoulder, a frozen shoulder. So apart from arthritis and trauma, there are specific causes in each joint, and they differ from joint to joint. But the two broad areas would be arthritis and injury.
Okay. And so, is it possible that I can get some over-the-counter options to take care of this joint pain, or do I need to go to Colorado?
So certainly, the most common one would be just good old-fashioned Tylenol, which comes, in generic versions. The limit on that is 3 grams a day. It used to be 4 grams. They dropped it to 3 because of liver issues. And then you have the whole range called anti-inflammatory medicines. For example, ibuprofen, which comes as Advil or Motrin, naproxen, which comes as Aleve. One has to be careful with these groups of medicines because they can cause stomach problems and kidney problems and raise blood pressure, and you can't take them if you're taking blood thinners. So generally speaking, Tylenol is a safe option. The anti-inflammatory medications you should check with your doctor. And apart from that, there are various balms and ointments which have, I think, a very small benefit because most joints are too deep for things that apply to the skin to get to them. So basically, you're talking of Tylenol and anti-inflammatories. And then there are these supplements called glucosamine sulfate. They're a bit hit and miss. Some patients have had benefit. The vast majority, not that much.
Okay.
So sadly, there's fairly limited options over the counter.
All right, so good. So that gets me to my next question because once I'm taking 27 Tylenols a day, I'm still in pain, right?
Yeah.
So where do you suggest? And listen, I know this is a loaded question, but where do you suggest that someone kind of draws the line in the sand and says, okay, I need to go see Dr. Michael. I need to see an orthopedic surgeon, orthopedic expert. When do I get to that point?
I think certainly if your pain is persistent, and by that I mean perhaps over a week or so. If you have swelling always indicates something happening like inflammation. If you have loss of movement, and perhaps instability, if the joint is kind of giving way on you, that certainly is not good. So I would say most patients probably go to their primary care physician initially, but certainly you have the choice of just going to the orthopedic surgeon. I'd say persistent pain lasting more than a few days, joint swelling, stiffness, and the joint feeling unstable would be the main 4 symptoms.
Gotcha. Or if I can't walk, or lift a body part, that's probably a time that I should come, see somebody, right?
Absolutely. Yeah.
All right. I'm just saying, there are certain telltale signs for me. Being married to a nurse, I will tell you that whenever I have a pain of any kind, I typically am instructed to go see a doctor. But I will also tell you, being married to a nurse, that whenever she has a pain of any kind, there's no chance she's going to see anyone because she knows exactly what's wrong. So anyway.
The doctors are very bad patients.
Right.
So.
That's very funny. All right, good. So talk to me about hip pain because this is a big deal now. So what are the most common factors for hip problems?
So again, the most common problem would be arthritis, and the most common form of it would be what's called osteoarthritis, which is basically the joint degenerating. And in turn, the reasons for that are sometimes unknown cause, often overweight, obesity, carrying heavy loads, various kinds of injury. Sometimes people who are born with hip deformities, all of those can, in the end, lead to the joint wearing out. So that's the most common group of people who have hip pain.
Right.
Hip injury, for instance, people have a fracture that doesn't heal well, can lead to arthritis. And I said to you earlier that there are specific causes. In the hip, a not uncommon cause is something called osteonecrosis. That word necrosis means dead bone or death. And in the hip, there are some conditions that lead to the bone dying. For instance, people who consume excessive alcohol, people who have taken medical steroids for a long time, people who have trauma. So those would be the 3 main categories: arthritis of various kinds, this osteonecrosis, and then injury.
Okay. So when we come back, I want to talk about some options for treatment, and then you can also tell us about this anterior hip procedure. Sure. But, because I thought the only treatment was amputation, but apparently there's other things that we can do. So we're going to talk a little more with Dr. Stanley Michael, orthopedic surgeon and medical director of the Joint Replacement Program at Southern Ocean Medical Center, right after this.
Everything you need to know about the Jersey Shore. This is Wake Up with Jeremy Grunin. News Talk Radio, WOBM AM 1160 and 1310. Get up, get out, do something. Wake Up with Jeremy Grunin continues. News Talk Radio, WOBM AM 1160, 1310, and WOBMAM.com.
We're no red light. We're back with Dr. Michael. Southern Ocean Medical Center, orthopedic surgeon and medical director of the Joint Replacement Program. So when we left, you were going to give us treatment options for my hip problems other than amputation. Go ahead.
Right. So, the initial treatments would always be the simple ones. We talked about over-the-counter medicines like Tylenol, and various anti-inflammatory medications. Going beyond that, mechanical devices, for instance, walking aids, not something that's very popular, but certainly can help. Using a cane or crutches or a walker based upon patient's age can take load off the hip. Once you get past those, and if they haven't worked, physical therapy can be tried. It does help some patients. It doesn't help as much as with the knee or the shoulder. And once you get past that, then you're generally talking of treatments that are more aggressive. Injections of cortisone, steroid, used rarely in the hip. Rarely because to inject the hip, you have to do it under extra control, which generally means a visit to the hospital or radiologist. Also, it's cumbersome to do. It's done often as a trial. When you're not sure if someone's pain is coming from the hip or the back, then it's a good thing to do at least one time just to see how much relief someone gets.
Right.
And really, once you get past those treatments, then you're looking at joint replacement. So if you haven't really been helped by the over-the-counter medicines or prescription pain medication, physical therapy, assistive devices, injections, you're really looking then at a hip replacement, because presumably by then your arthritis is too far gone to be helped by those.
Right.
therapies.
Right. And you have, so there's an anterior hip procedure that you have, which is a different kind of hip replacement, which is different than the traditional hip replacement. So if I want to get back to my twerking days, which hip replacement would you recommend?
Well, I've been around long enough to have done all the approaches, and so I know the pros and cons of each. The anterior hip replacement really, I think, is going to be the gold standard in the future. The word anterior means from the front, lateral means side, and posterior means from the back. So you can get to the hip from the side or the back or the front. The problem is when you cut into the ball and socket and replace the hip, the artificial socket is much shallower than the natural socket. So the hip tends to be unstable until the ligaments heal. So if you go from the back, when someone sits, the ball wants to pop out the back and dislocate. When you go from the front and someone sits, which patients do for a big part of the day, the back has not been touched, so it's a pretty stable approach. And we do lots of things in life sitting in car seats, sitting in chairs, sitting on toilets. So the anterior approach is very stable for that reason. It also hurts less because you go between the muscles, you don't cut any muscles. Therefore, the patient has less pain, which then means they take less narcotics, they're more alert, they have less nausea, less constipation.
Okay.
And there are other benefits that I can talk about, but those will be the initial ones patients notice. Less pain medication, and less restrictions on what they can do.
Okay. We only have about a minute left with you. So I guess real quick, talk to me. Rehab, do they do it on site? Can they go home? What does that look like? What's the rehab time frame look like?
So with the anterior approach, many patients go home the next day or after 2 days. Some older patients will go to rehab for perhaps a week or so. They have much less restrictions. I've had patients drive a car at about 10 days. Not that we recommend it, but some patients feel so good that they do. I've had patients go back to work at an office job at less than 2 weeks.
Awesome.
So because they have less pain, less restrictions, they get much more functional, and the rehab is really quite minimal. In fact, some patients don't do rehab at all and still do fine because there isn't that much needed with the anterior approach.
Great. Well, that's great. Dr. Michael, thank you so much. I feel like you've taught me a lot today about orthopedics and about my future hip replacement, which I will no doubt need. Thank you. Thank you so much, and I appreciate you spending some time with us this morning.
Thanks for talking to me.
All right, great. Dr. Stanley Michael, orthopedic surgeon and medical director of the Joint Replacement Program at Southern Ocean Medical Center. Oh, my God, look how that timing worked out. It's like I could do this professionally. Just about at 7:30. We actually have someone calling in at 7:45 from our gang players telling us about some stuff that we may want to do this weekend. We'll be right back after the news. Wake up with Jeremy Grunin.
The news never stops at WOBMAM.com. Get the latest from WOBM News, the Town Square, New Jersey News Network, and Fox News Radio. Wake up with Jeremy Grunin. News Talk Radio, WOBMAM 1160 and 1310.